This is Catherine. She's 20 years old and has been sick with Lyme disease for 9 years and is now at her 19th week of treatment at Spinagle Wellness. She has 2 to 3 more months left and a year of recovery. Is there anything unique about Kat as a patient?
Well, all our patients are unique because they all have different chemistries and different immune systems and markers. But what's unique about Catherine is her amino acid, or her essential amino acids for her immune system. Dr. Spinagle even mentioned that she has the lowest amino acid profile than anybody he's ever seen.
What was your life like before Spinagle?
It would be hard to call what I had a life. An average day for me would be waking up in extreme pain, then needing help walking to the bathroom. My mom and boyfriend, who were my full-time caretakers, would basically move me from the bed to the couch, and that's where I would stay almost all day. Other than that, I would have at least 2 seizures, so I wasn't trusted to be left alone for that long. And by the end of the day, I would have an intense migraine and extreme nausea.
How was it possible that with all those symptoms and going to see so many doctors that you've been this sick for 9 years?
It didn't start that way. Lyme, and what I'm learning from my current doctor, exposure to toxins like black mold and benzene, slowly took over my body. It started out with just being really tired and getting the flu 6 to 7 times a year. The exhaustion kept getting worse, and I started missing every other week from school for one illness or another. I started seeing doctors, but they usually just dismissed me as a depressed teenager, and it wasn't until I started coming in with a blood pressure of 65 to 70 over 50 and started having seizures and trouble walking that they started to take me seriously. I started to see even more doctors, and every time I would come out with a different diagnosis. By the end, I had been diagnosed with Hashimoto's thyroiditis, postural orthostatic tachycardia syndrome, chronic fatigue, lupus, Ehlers-Danlos, peptic ulcer disease, chronic migraines, fibromyalgia, something to do with the left ventricle of my heart. I had developed a brain Chiari, of course, chronic Lyme disease and its co-infections. I was exhibiting MS symptoms, and when I came here, I learned I was in the early stages of Alzheimer's.
Was Lyme your last diagnosis?
No, I was diagnosed with Lyme 4 years ago, but it was never taken seriously by many doctors, especially as the reason for my being so sick.
But Lyme and toxins were the root causes of your illness?
Yes, they were. And Lyme literate doctors knew that, but so many of them couldn't do anything to help me because treating Lyme for longer than what's allowed by state medical boards, which isn't very long, and the treatment that they're allowed to do, which isn't very much, didn't do enough to help me.
But now?
Now I've found a place that can truly help me. I have now, without a doubt, the smartest doctor I've ever worked with. I've seen him work miracles on people much sicker than I am.
So you're going to get better?
I am. My health will always be a constant battle because Lyme is a growing epidemic and the growing amount of toxins in the world. Some days, not most days, but some days I feel stronger than ever, and just knowing that I have a future and, having a little strength now and then to do the things I used to love so much is an incredible feeling.